Now to a developing story as cases of monkeypox grow across the country. California now has more than 430 cases. That makes up about 1 in every 7 cases of monkeypox nationwide. CBS News' Natalie Brand joins us live from Capitol Hill with more on this. Natalie.
Good afternoon, Amanda. And San Francisco is actually at the top of the list of places in the state with the highest case count. That's followed by Los Angeles. Lawmakers here on Capitol Hill, they've written to the administration saying the current federal response has fallen short.
The World Health Organization now says monkeypox is a public health emergency of international concern.
We have an outbreak that has spread around the world rapidly through new modes of transmission, about which we understand too little and which meets the criteria in the international health regulations.
Here in the U.S., Dr. Ashish Jha, the White House COVID response coordinator, told CBS's Face the Nation the administration is looking into potentially declaring an emergency, but they're not there yet.
We think we can get our arms around this thing, but obviously if we need further tools, we will invoke them as we need them.
The CDC reports there are nearly 3,000 confirmed monkeypox cases nationwide, and that includes 2 new cases in children, likely the result of household transmission, according to health officials.
Anybody who has monkeypox can spread it to others. It is through skin-to-skin contact, direct and prolonged contact. We're not surprised that you're going to see some other individuals get infected as well.
Lawmakers are calling on the White House to step up its response. A group of 50 House Democrats wants the administration to declare a public health emergency to accelerate vaccine delivery.
I don't know why there aren't more vaccines available. I'm hearing from healthcare providers in my district that there are people lining up to get vaccinated and they don't have the vaccines for them, and that is a real problem.
We're going to be releasing hundreds of thousands of more vaccines in the next days and weeks. So there is a very substantial ramping up of response that is happening right now.
But for now, in the nation's hotspots, local health officials are prioritizing first doses for at-risk people until they receive more supply.
And that includes San Francisco, where on Friday, the public health department even said that they would have to defer second doses of the vaccine until supply increases. Amanda.
Yeah, a lot of people were waiting to get those shots, too. Natalie, people in the Bay Area have called for more urgency because of all this from the federal government on getting those vaccines out. So does the Biden administration have a timeline for doing that? We saw all those people turned away just last week.
Right, and Dr. Jha, as you heard from him on behalf of the administration, he said that they are working on ramping up supply. But again, lawmakers say this needs to happen faster, and they've described what they call a regulatory logjam that has prevented doses from shipping into Europe. The FDA, for its part, says that it has inspected and is currently evaluating a facility, a manufacturing facility in Denmark. And doses from there could be approved as early as end of this month. And that could mean an additional around 780,000 doses into the current government supply. That's on top of the additional doses that have been ordered by the administration to come over the course of the next year. But again, local health officials, state health officials, and here lawmakers, U.S. members of Congress calling for more urgency and for the vaccine supply to be increased immediately. Amanda.